Hi everyone, it's Dr. Samantha Benjamin Allen, board certified in physical medicine and rehabilitation, here to talk to you today about another topic. I'm going to talk to you about how to move after you have a hip replacement. Now, a hip replacement is generally indicated for severe arthritis. After you've tried all the conservative measures, you've tried therapies, medications, topical agents, injections, or other conservative measures, and still have severe arthritis that has significantly impacted your mobility and your ability to function, and you've been told you have to have a hip replacement. Now, other reasons can indicate a hip replacement being warranted, like osteonecrosis of the femoral head. So think of the femur being my arm here, and then the socket of your hip being my hand. So osteonecrosis tends to happen in the femoral head in certain pathologies. So sometimes that's an indication for a hip replacement as well. Now, if you have been told that you need a hip replacement, always know that prehabilitation is your best chance at having a great outcome. So you want to prehabilitate that hip before you have surgery by getting therapies for that hip to strengthen it, so that you will have a better recovery and a more speedy recovery. And a rehab doctor is the perfect person to prescribe a program for you to get your hip in good shape and ready so that you can sustain recovery and rehab after surgery. Now, say you had a a hip replacement. I don't know why I keep talking about knees today. Maybe that's the next video I'm going to talk about. But yeah, if you had a hip replacement, there are certain ways that you have to move to prevent that hip from popping out of socket, or you having some adverse outcome that will damage the hip and possibly cause you to have to get surgery again, or have to get it put back in the socket, all of which are painful. So we want to avoid that. So one, you want to avoid bending your knee past your waist. So you don't want to bend your knee to the point that it is passing your hip. So if you bend your knee, it needs to be in line with your hip. You don't want to pass that point. If this is your knee and this is your hip, no, do not bend your knee past 90 degrees or past your hip, okay? Now, there's also something else you want to avoid, which is crossing your legs. So we don't want to cross our legs when we have a hip replacement, okay? That can put you at risk of putting it out of socket. Next thing you want to do is avoid twisting your leg. So avoid pivoting your foot or twisting your foot in and out, or inverting or everting your foot, because this can also twist that femur, the head of your femur, which is here, twist it and make it pop out of place. And your surgeon will give you precautions for your hip, because there are different surgical approaches to getting a hip replacement, and certain approaches require different precautions. So I just gave you the basics, but you want to talk to your surgeon about what those precautions are. So basically, you don't want to do any extensive flexion, extension, so that's moving the leg forward, backward, or twisting of the leg. Let's keep it simple that way. So if you're sitting, you don't want to bend down to pick up anything off the floor. You will need a hip kit. A hip kit helps you to move safely after you have a hip surgery. So a hip kit usually includes a shoehorn, a reacher, and a grabber. So it's something to help you pick up objects so that you don't disobey your hip precautions, okay? And I just want to give some tips to the athletes, because after you have joint replacement, usually wondering, when can I get back to running, right? So let's just talk about runners, since that's one of the most high impact exercises that we can do, and repetitive high impact. So usually recovery is about 3 months. 3 to 6 months is about average. And there was a study done and published in April of 2023 in the Journal of the American Academy of Orthopedic Surgery, where they studied 4,000 participants after hip and knee replacement, and to see how they did returning to their athletics after surgery. And interestingly enough, of the people who returned to running after surgery, 6.2% of them ended up needing to get that joint replacement revised or redone, and 4.8% 98% of people who did not return to running ended up needing to get their joint redone. So there's always the risk of having to get it revised, but that number isn't starkingly high, so it's worth having a conversation with your surgeon to get clearance from them, because ultimately you have to get clearance from your surgeon to return to that activity. But if you have a rehab doctor on your team, we certainly partner with your surgeon to come up with the best plan to get you returning to your life and have the quality that you desire and function. And if your athletics or running is something that you value and adds to your quality of life and is also good for your well-being, obviously we want to try to do things to help you get back to it, but do it safely. Okay, so that's just something to know. And know also that knee replacement clearance is longer than hip replacement, because running and high impact affects your knees more than your hips. So for the knee replacement patients, it was more like a 12-month wait to return to running, not to return to sports or exercise entirely, but just the high impact. Okay, so I think that's helpful to know and something to talk to your surgeon about. Okay, now I'm gonna leave it at that because this video is getting a little long and I don't want to keep you, so I'll probably have a more extensive video on YouTube, or I'll split it and talk a little bit about the knees in another video. So hope that was helpful for those who are listening. And if you are a person who's had a hip replacement and maybe suffering with debility afterwards, not having the outcome you expected, and struggling to get back to living your life and thriving, I invite you to join me at Freedom Wellness Physiatry by booking an appointment at www.freedomwellnessphysiatry.com, where you can partner with a physician who is dedicated to seeing you thrive despite your circumstances and get you living better. So you can call 240-339-5377 as well, and we will be happy to work with you. Thank you and have a great day. Bye-bye.